I've been working as a receptionist, but recently I switched to another position as a CHW, which is a community health worker. The patient's journey begins with you. It doesn't matter who you are in the organization, we all can make a difference in a variety of settings. Seeing how grateful patients were really impacting me.
My team here at Harvard Street has been very, very helpful, relating primarily to the center's food pantry and making sure that the health center actually has the supplies needed in order to render good quality health services for our patients.
As a medical assistant at Codman, I strive to be a friendly face for the community members to show them they're welcome and receiving high quality care. I am the first clinical contact a patient sees when they arrive for their visit. I try to make each patient feel as welcome and as comfortable as I possibly can.
BNHC is the only source of care for the most of our 37,000 patients, many of whom face countless barriers to health care. They know we are always be here for them.
During the pandemic, there was a lot of changes for me. I was a part of the CTU team to help with registrations, both here at Dawn House Health and offsite in the community to provide accessible COVID testing for our patients. Dawn House Health is located in the heart of the Vietnamese community. With me being Vietnamese, I can understand the culture and the language, which creates a safe space for patients to be able to access the service they need.
I strive to carry out our health center's mission by making sure our patients can receive safe and dependable health care, especially during the challenging times of the coronavirus pandemic. Our patients depend on myself and the rest of the public safety department in many ways. Between our dedicated public safety officers and door greeters, we make sure that our patients can navigate through the facility and are safe while doing so.
At Edward Kennedy, we make sure that our patients have easy access to the medical care, especially during the pandemic. Our patients depend on us to help them live healthier lives. We do this by booking appointments, providing them with resources, by help them navigate through any medical insurance challenges, and also providing quality care with kindness and a smile.
My role as a nurse manager is a critical role in aiding in the support of our patients and staff. I spend most of my day out at the nursing station supporting my team of medical assistants and nurses. My priority was to follow safety protocols and to keep our staff and patients safe and healthy by ensuring we always had an adequate supply of PPE.
I strive to carry out the mission of our health center by continuing to stand behind our mission to be compassionate and empathetic to the patients that I serve, even through the most difficult and challenging times throughout the pandemic. Being flexible is also key when working in healthcare.
I'm responsible for organizing and managing patients' health information. I carry out our mission by being inclusive regardless of the patient, providing an utmost service to fit every patient's needs. During the pandemic, providing these services not only through medical records, but also being flexible and helping where I can.
I strive to maintain Fenway's mission, especially throughout the pandemic, by assuring that my patients have access to quality, compassionate, and supportive care despite the barriers that they may be facing.
Wellness calls, home food deliveries, Lyft rides, COVID safety kits, medication home deliveries, virtual and phone visits, community resources. These are only a few of the ways we have and will continue to meet the needs of our patients and members of the community.
Providing access to our community, because that's one of the best ways we can help them stay healthy. And we do that by allowing the patient to reach us by phone, by calling us, sending messages through MyChart, as well as providing after-hours answering services. We also provide access to interpreting services as well as behavioral health services. And then on-site, you will also find a pharmacy, a Quest lab, as well as dental services. Whatever the barrier may be, we are here to help them overcome them.
During the pandemic, I strive to ensure that our patient service reps are well informed of our new changes and mask mandates so that we can best help our patients with any questions and concerns. Being bilingual in both English and Spanish allows me to reach a wider range of patients in our diverse community and helps me provide patients with accessibility and essential services in healthcare.
As part of the security team, we ensure the protection of all staff and patients and secure all clinical properties on site on a day-to-day basis. During the pandemic, security and staff, we became like a joint force, effectively communicating and maintaining COVID-19 guidelines.
During the pandemic, we had to change our indoor shower program for the homeless and do an outdoor shower program. With the help of a MEMA trailer, we were able to do showers for people outdoors in the mornings 3 times a week, rain or shine. We had a tent. We also had a fairly vigorous vaccination program for our patients. There was initially a lot of reluctance on their part, but eventually we were able to pull in quite a few of our patients to get their vaccines and now continuing with their boosters.
By working at the front lines here at Family Health Center of Worcester, I was able to make sure that our patients felt safe and protected. I was ready to jump in whenever I was needed, and I provided them with information and support during such uneasy times.
It was important for me to let our patients know that although 3/4 of the country was shut down and the roads were empty, that our clinic was not closed. There's going to be someone there to hold their hand with them during procedures and make them laugh, make them smile, and not feel as though it's the end of the world, even if they do get a bad diagnosis, that they're not alone.
I've seen patients grow and their families grow. We serve a lot of people. The assistant, the providers, the caring, we do a lot, and I'm celebrating 40 years here.
During the pandemic, when stress levels were extremely high, I recognized the most important way to contribute to the health center's mission was to be available to my staff, support them, and fill in wherever help was needed. Additionally, provide a positive patient experience by being available to the patients and troubleshooting issues and concerns.
I worked for Chuck River Community Health 21 years. The first we had a COVID test and the vaccine side. We had education, give for them information, how they protect it. And we go together, improve the health and well-being for community, save it with the provider, we save it in the research, the patient, how we do.
During the COVID pandemic, I tried to carry out the Uplands Corner Health Center mission by providing access to integrated behavioral health and social support services. I know that patients depend on me and our multidisciplinary behavioral health team for emotional guidance. It starts with building trust that I'm looking out for them and will help them make the best decision for themselves and or their families.
Throughout the pandemic, I have carried out the mission of Boston Healthcare for the Homeless. I make every effort I could to answer and help any question of the patient related to vital signs and activities of daily living.
Hola, gracias por la nominación. Me enorgullece brindarles a todos los pacientes de nuestro centro de salud una atención excelente al vacunar cientos de pacientes y miembros de nuestra comunidad. También me siento extremadamente orgullosa al ver el arduo trabajo que todos mis compañeros brindaron al administrar pruebas de COVID en todo tipo de clima y largas horas. Durante la pandemia, las puertas siempre estuvieron abiertas para nuestros pacientes, sin importar de dónde son o si tienen seguro médico. Mil gracias.